Today, we're talking about pelvic floor tightness and why you need to begin with this when you're trying to improve your pelvic pain, your back pain, your hip pain, or even your endo flares. Most people with endo or pelvic pain will have a tight pelvic floor, and they know this because they're going to have a lot of symptoms around having troubles getting anything in or getting anything out, if you know what I mean. Now, these are very obvious symptoms of pelvic floor dysfunction, but what about other symptoms? Symptoms like back pain or hip pain or tailbone pain. Maybe flares from exercise, maybe even abdominal cramping pain. Did you know that these are also signs of pelvic floor tightness? I'm Courtney, an exercise physiologist specializing in women's health, and I see this all the time. And it's generally with my clients who don't even realize their symptoms are actually coming from their pelvic floor dysfunction. In this video, I want to explain why the starting point for endometriosis and pelvic pain rehab should focus on addressing the pelvic floor. Before we dive in last week's video, I talked about what exercise might actually look like when you live with endometriosis and pelvic pain, and we discussed why the first phase is usually rehab based. In this video, we're going to dive a little bit more into what that rehab looks like and talk about why pelvic floor is the beginning of that rehab process. If you missed that video, I recommend that you check it out. I'll leave the link in the description bar below. This is pelvis Presley, and I use this pelvis model to highlight and demonstrate where the pelvic floor actually is for my clients in the clinic. Understanding a bit about the anatomy of the pelvic floor is really important because when we talk about how do we relax this, what are we looking to feel, having a visual idea of what it actually looks like is really, really helpful. Otherwise, many people don't even know where it is, what it looks like, where it attaches to. So when I'm asking them to visualize it, who actually knows what they're visualizing? As you can see, the pelvic floor spans quite a large space. And if you look at the front here, we can see it has attachment points to the pubic bone. It attaches to the tailbone at the back, and it also links up and attaches to other parts of the pelvis. And through this network that we call fascia, it integrates and connects with other muscles that attach to the pelvis at different points. Now, imagine this network of fascia is like a giant stocking that wraps around a muscle tissue, and it continues on, wraps around the next one, continues on, wraps around the next one, and it continues like a big giant sheath of stocking all throughout the body. This means that tightness in one muscle can feed through fascia into the next one because it shares connection points with the fascia or other muscle tissue. So tightness in one muscle can cause tightness in another muscle and result in what we call referral pain. Referral pain is the term that we use to describe pain sensation that is felt somewhere that isn't actually the source of the pain itself. The pelvic floor is a great example of a muscle that can create a lot of referral pain because when it is tight, we can feel this in other areas of the body. And those areas typically look like the low back, the back of the hips or the glute muscles. We can feel it maybe even in the inner thighs, sometimes even this lower belly, abdominal cramping type sensation that you might be familiar with. And this can actually be coming from tension in the pelvic floor. This is why anyone who experiences pain anywhere in the area of the pelvis, and this is regardless of whether there is an endometriosis or chronic pelvic pain present, should always kick off their rehab by addressing the pelvic floor and doing pelvic floor specific exercises. And I don't always mean squeezing and contracting and lifting and tightening like Kegel exercises. There's a lot more to it than that, but it's very important that we start there. So for things like back pain, hip pain, SI joint pain, all of these things can be a sign that your pelvic floor is actually tight. And if you don't address the pelvic floor at all, then you might find that those symptoms never actually improve, no matter how much physiotherapy or muscle retraining work you actually do. So where do you actually start with these exercises? Typically, this looks like pelvic floor physiotherapy where we get manual release work done. Maybe you're doing some relaxation exercises, some breath work and some stretches, but that's not the only way we can address pelvic floor tightness. And it's definitely not the only part of the programming. It must be progressed from there. But we're going to talk about that in another video because there are many drivers to pelvic floor tightness, and it's not always just about pelvic floor release work. So stay tuned for next week's video because we're going to be talking about that a little bit more in depth. But if this resonates with you and you have symptoms, ongoing symptoms of pain, anywhere around the pelvis, the low back, the hips, the glutes, the back of the legs, and you haven't done pelvic floor specific exercises or addressed your pelvic floor in any fashion, and maybe you don't have endo, maybe you don't have chronic pain, you just have these symptoms, I really encourage you to seek out some support for your pelvic floor because this is such a problem in all of these areas that is often missed when we're not seeing like a women's health specific clinician. I promise you, it can be an absolute game changer in getting results and stopping those bothersome symptoms that you keep getting. And if you are already doing pelvic floor specific exercises and you're finding that your symptoms still aren't improving fully, maybe you've got some results but hasn't fully resolved, then there's something else that's missing from your programming. And this is what we're going to be talking about next week on the channel. So subscribe, stay tuned. I upload videos every week and we talk about where exercise fits into your women's health condition. See you in the next one. Bye.